you, leader, that right now on thinking of.
Good morning, Commissioners.
Good morning.
Thank you so much for the opportunity to share with you today on Medicaid expansion and what expansion means for us as a community.
And tell us who, we know who you are,
Yes,
but out
that's
there
my
in
next
TV land,
statement. I am Candace Goebel. I'm the director with the Department of Social Services here. I also brought two of our staff members with me today, Danae Pickard, she is our Economic Division Director, and Jamie Hatfield, who is one of our program administrators and works closely with our Medicaid staff. So I'll start just to talk a little bit about expansion and how it come about. We know that this has been a conversation in North Carolina for quite some time now, but it hasn't had the momentum that it needed to go before the legislatures and to be passed, which is where we are today. There are currently 39 other states that have signed on to Medicaid expansion, some dating all the way back to 2014, and North Carolina will be the 40th state to expand their Medicaid coverage. It did start out as House Bill 76, which was signed into law on March the 27th of this year. And although it was signed into law, it wasn't quite ready for implementation. There were a few things that were required, such as North Carolina had to present a plan to CMS, which is the Centers for Medicare and Medicaid Services. And then, of course, there was funding that was needed to implement such a big initiative. And so it was tied to our budget bill. There was funding that was indicated in House Bill 76 in Section 1.6B, and we will talk a little bit more about that in some future slides. And while the budget bill did become law without the governor's signature, prior to it becoming law, the governor did instruct North Carolina Department of Health and Human Services to go ahead and set a go-live date. So what that means is that Go Live is set for December the 1st, and that is expanding access to many, many North Carolinians aged 19 to 64. This is a huge population gap that has been missing coverage for quite some time. Many of those individuals that are currently receiving in that population are meeting some of those Medicaid criteria right now, such as having a dependent child in the home, or they have been deemed disabled. And so they are estimating that 600,000 North Carolinians will now be eligible for Medicaid coverage. And some in that 600,000 may already be receiving, but will be receiving in a lesser benefit program. And I've listed up here on this slide a few of the criteria, such as being a resident of North Carolina, age 19 to 64, being a U.S. citizen, and then, of course, the household does have to fit within certain income limits. And really just to share more for the public to understand how you can apply for Medicaid, there are multiple ways that you can apply. One of those is online. That's going to the ePass portal and having access to be able to do it from your home computer. It comes directly to us at DSS. You can mail in an application. You can come into our office in person, or you can call our office by phone. So now I just want to transition a little bit to talk about our current staff and current workload that we have within the county. We have 41 dedicated staff members who actually determine eligibility for Medicaid in our agency. Some of those are in adult Medicaid programs. Some of those are more specialized programs like long-term care, CAP, special assistance. Others are in our family and children's Medicaid. And each one of those policies has different criteria to meet eligibility for those. We also have three income maintenance caseworker 3s, which offer training services to our staff. They offer quality assurance, which is an important piece, as the state does require us to take a look at the work that we're doing to ensure the accuracy. Of course, accuracy is important when audits come along, because any responsibilities that or any eligibility that's determined in error, we as a county have the paybacks for that. So it's important to have those quality assurance pieces. And then we have one specifically that does do quality assurance as their sole position. So they're reviewing a certain amount of work that's being produced by our staff members. And then, of course, all staff members do have to have a supervisor, and we have 5 supervisory positions. So on a monthly basis here in Alamance, we generally do take between 500 to 800 Medicaid applications. There are two dispositions that could happen. They're either approved or denied. And both of those generally take the same amount of time because we rely on individuals to return information to us to be able to make that eligibility determination. So after approval, all of those individuals are required to be reevaluated in the first year and then again another year. So we are constantly doing reevaluations of Medicaid programs to determine if those individuals remain eligible for those services. As of September of this year, we had 37,872 cases, and within those cases, there were 53,000 beneficiaries. And so you can imagine that households are comprised of multiple people that may receive benefits. So we see the number of beneficiaries are higher than the number of cases because we could have multiple children on a case. We could have a whole family on the case, just depending on when they all applied. Based on the totals here in Alamance County, looking at population, around 30% of our residents here are receiving Medicaid benefits. And that might not be full Medicaid benefits. That could be some of those partial benefits like family planning services. It could be Medicare premium services. Any of those. It just really depends on your eligibility for the Medicaid program. Yes, sir.
I have a question. 500 to 800 a month.
Mm-hmm.
At some time, you would think you would reach a saturation point. Is there repetition in the process?
You would think so. Sometimes we do see churn where individuals do fall off of Medicaid and reapply. I think what you will see as we move into expansion, we are touching cases that we have previously terminated at an earlier date because they were no longer eligible. Now they are. So we certainly have
issues?
It could be income. They started a job, stopped a job, started a job, stopped a job. It just really depends on the situation of the household. But we too have thought at some point we probably wouldn't receive this amount. And it also depends on the amount of or the time of the year. So we have moved into open enrollment. So something that you may not know is with the federal marketplace, anyone that may be eligible for Medicaid, they send that application over to us. So these aren't applications that we take in our agency. They're coming to us from the federal marketplace, and we have to determine eligibility for them before the next steps can be taken at the federal marketplace. And that occurs all throughout open enrollment, and we see upwards of 1,000 applications that come just from the federal marketplace for us to determine eligibility.
Wow.
We also continue to get calls because folks are wanting to progress further with the federal marketplace, but we have to do our due diligence to determine eligibility, so that takes a little bit of time there.
This is not all you do, is it?
No, it's not.
Can I ask you a
Yes.
hard question?
Yes.
Not you, but just a hard situation.
Yeah.
Several months ago, with the conditions of our border, our southern border, we see a lot of influx of whatever you want to call that. And I had read in the paper where there are going to be, maybe it's through the school system, there were going to be like around 572 new folks coming in on that situation. Is that an automatic Medicaid sign-up situation? Because I know the health department probably has to get vaccines if they've never had any kind of vaccinations. I don't think maybe our public, I mean, it's just overwhelming to know that when someone comes here, if they aren't a citizen of our country yet,
Right.
all the stuff we provide. There are also children in our schools that may have a language barrier. The family has an even bigger language barrier. It just kind of just tsunamis. So is that population, some of that 500 to 800, is that some of that population as well? Not picking on anybody, I'm just asking
No.
questions.
I think we have seen some. Specifically, we've seen some of the refugee families that
right.
are moving into the county right now.
That's a better word, thank you.
It really depends as far as Medicaid benefits, what type of documentation they have. Our policies are very specific as to what asylee, refugee, where they're from, just different types of things that we have to look at, and it all is around their the qualifications that they have that are issued through their legal permanent resident card or whatever documentation they have given.
Well, I know absolutely no public school can deny any child
Sure.
if they're from Mars, it doesn't matter.
Right.
But I was just curious how that's just, that really adds up, it does, and I know DSS is, what you had a big plate, that's all I'm gonna say.
And generally speaking, children under the age of 19 are more than likely going to receive those Medicaid benefits, but the parents may not.
Okay,
But the applicants do have to be citizens of the United States, correct?
So there are Medicaid policies that do allow Medicaid coverage for qualified aliens, but also for even those that are unqualified aliens. It depends on the state of the emergency. And so the hospital may send over an application to us, and there's an outside entity that's a panel of doctors that goes through that emergency situation and determines whether it's a true emergency, and then identifies the dates of service that they will approve and send that back to us. And that's what we have to key into the system.
Thank
Okay.
you.
So I'll also mention that the current workload right now, as many of you have probably heard, a lot of the COVID waivers have went away. And so we are now having to terminate Medicaid cases that we were unable to do so early on. So these staff members are not just doing their normal day-to-day work, but they are now having to evaluate all of these cases that are potentially eligible or ineligible and make changes to those cases based on the situation. And that's known as the continuous coverage unwinding. And so that is one of the pushes that the state has tried to implement Medicaid expansion early on so that counties weren't having to touch these individuals multiple times. But we have had, starting in May, to start terminating services to individuals that were no longer eligible, meaning that those individuals will be back applying for services again.
What's the difference between that, what's that time, the in-between? Like if it stops, you said it's starting back in May, how much time was there nothing?
So it would be from June until December 1st.
Okay, and so it's kind of like Meals on Wheels. During COVID,
Yeah.
we added all these extra
Yeah.
folks, and then we have to take them off, but they still
Sure.
don't stop eating till you go back on.
That's right.
So what happens with that?
So they unfortunately don't receive Medicaid services. Yeah.
So you pray you don't have nothing wrong with you.
Yeah.
Okay.
And I think that's a hard part of our work
Yeah.
because we every day have to turn down services for individuals. But as an organization, we really do try to have resources available. So can we make a referral to the Open Door Clinic? Can we refer them over to Charles Drew that may have a sliding scale that can accommodate their needs? So it's really, even though we might not be able to help, it's working to identify are there resources in the community that we can refer them
And the
to
health department can play a big part in that, especially with the dentist
for
office.
vaccinations and
Yeah.
stuff like that
Okay.
for the children. Yep.
Dr. Tony.
All right, so we'll move forward into the projected workloads and what we're anticipating to see whenever Medicaid expansion is actually implemented on December the 1st. I mentioned that there were around 600,000 North Carolinians that would be eligible within the state. And what that means for Alamance County is around 16,595 individuals will potentially be eligible for Medicaid expansion. 11,733 are estimated to be new applicants here in Alamance County. The remaining are those that are already receiving benefits, just in a lesser program. So meaning they may not be able to seek medical care when they're sick, but for women, it may provide birth control pills. It could provide some of those Planned Parenthood services that many are in need of. So both of these do require extensive effort on behalf of our staff. If you think about 11,000 new applications coming in on December the 1st, that is certainly something that we are have a little bit of anxiety about, just for the simple fact of being able to process them timely. It also requires us to do a reevaluation of those cases. So we are currently working our monthly caseloads, and now we have to touch those cases that may be eligible. I can tell you from the time that the bill was signed, we started receiving phone calls about Medicaid expansion. So we know that there is a great need within our community to implement it. It's just being able to get through the processes of those applications and reevaluations.
One thing, Candace, because I don't want to ask you, I forget, this 39% that you're talking about, does that really correlate with just the reality of our poverty level in this county?
So
Is it a reflection?
So I would say possibly. I think we have a large population, unfortunately, that don't know what services DSS offers.
Right.
I've come into contact with a lot of individuals within the county that don't even know where our agency is located. So that's really hard. And sometimes there's the thought process that DSS is one entity. So if I come in there and share my story,
Yeah.
something else could
You
happen.
gonna take my children at 3 o'clock in the morning? Yeah.
And
No.
so that's certainly not the message that we want to share. And anyone that's eligible for these services should come in and apply. So,
Why don't you state where your location is
yes.
for the audience?
Yes, we're on 319 North Graham Hopedale Road. For those that are familiar with this county for a long time, knows that it's the old county hospital. So it's just located about 10 minutes from here. Yep. And so we generally do see an increase to our Medicaid caseload by about 4%. We're looking, as December the 1st comes, we're looking about a 22% increase to our caseload based on the numbers that they are anticipating. If you'll just keep in mind that those are estimates that were provided to us by the state in April of 22. There have been no new estimates provided to us to know exactly what that number will be. We also know that although there are 11,000 eligible individuals, we will probably get far more applications than that just to see if I am eligible for these benefits. And so if our population were to remain the same, this does increase the Medicaid population by about 9%. But we know that our county is continuously growing and that our population will more than likely increase over the next few years.
And McKinney-Vento with the school system, I would think anybody in that is in this as well.
So we would hope
Yeah.
that we're getting referrals for that.
Gotcha.
But yeah. All right. So let's talk a little bit about implementation challenges. And one of those has been policy. So we received policy on 10/23, just about 2 weeks ago, for Medicaid expansion. And what that means is we have about a month to train our staff to get ready for expansion to actually be implemented. I will tell you that Medicaid policies are very complex. I mentioned earlier that adult Medicaid, family and children's Medicaid, all of those are different policies. So we are now adding another evaluation to our eligibility determination. As I started my career at DSS, I was a trainer many, many years ago in Medicaid, and I used to describe it as trying to fit a square into a circle because you're sitting here looking and shaving off every little bit, so you're not eligible for this, but let's look at this. If not this, then what? And some of the charts and graphs that we have described or we are given to use are very difficult to read. So we say it usually takes about 6 to 9 months to really train someone to be proficient in Medicaid because there's so many if or then or what ifs. There's also no way for us to predict the number of applications that we're going to take in on that December 1st. There's been a lot of conversation around going ahead and applying, but although we say go ahead and apply, we still have a little bit of anxiety about that because of the amount of applications that we're anticipating to get. We do expect an influx initially, and we are currently trying to plan for what happens if 11,000 people show up at the HSC building on December the 1st. So we are working on that. The other challenge is our current workforce versus the number of new applications and redeterminations. It's that balance of making sure that we're meeting the needs of our citizens by approving these applications timely. It's also ensuring that they're being done accurately because, of course, any inaccuracies lead to county paybacks. And as I mentioned before as well, our staff are currently working on this continuous coverage unwinding. We're in open enrollment period. And we also have a specific type of Medicaid program that is always reevaluated in December, which adds about 550 cases to our caseload. So we have a perfect storm that's building here where we have a lot of work and a need for staff to be able to do so.
Let me interrupt you there.
Yeah.
The additional staff positions through the Medicaid expansion are paid by the state.
That is correct.
So we're not talking about money coming out of our county pocket. We're talking about state-funded positions.
So I don't know if you would technically deem them state funded, but based on the reimbursement that we receive back from the state with the additional monies that were outlined in the House bill, we aren't expecting to have any county portion that would be required for those new staff members.
And how many positions and what are the positions that you need? to make that?
They're in the next few slides if you want me to just hold off, and then I'll get to those. But I know 2.5 minutes. I think I'm a little over there.
Well, I was kidding about that.
We are not gonna-
And when I keep looking over here, ladies, I'm usually looking at the guy behind you and getting his expression. I have a health director
But
right
we are definitely going to get there. So I would just like to highlight a few of the things that the state has implemented in an effort to help the counties. One of those is straight through processing, meaning that our eligibility system, NC Fast, processes directly any applications or redeterminations that are entered through the ePass portal. I will tell you that the percentage statewide is very low for this. If you've ever heard of NC Fast, it doesn't always function as well as they anticipate it to. So that leaves most counties, including ours, to be in the single digit percentages for straight through processing. They do continue to alleviate some of the rules within the NC Fast system, and that's all within the Division of Health Benefits in an attempt to allow more of those cases to go through, but we're still seeing very low percentages. The state has also said that all of those individuals that need a reevaluation that are currently receiving, they're going to process that through NC Fast. I will say I'm a little unsure as to whether or not that will happen. I am very hopeful because that would alleviate a lot off of the county. But there is no guarantee that the county will not have to touch those cases.
Is that an AI process versus hands-on or person-to-person?
It would be just simply meeting the rules within the system that would pass you through and approve.
That means it might not shave off any of those rough edges to fit the square into the round.
It could. We hope that the policy guidance that's in NC Fast is accurate, though. So
Fast don't mean it's fast.
that's right.
Right.
I will also mention that there has been a push from the Division of Health and Human Services to ask legislatures to pass where the federal marketplace can actually approve Medicaid applications. This will not be available to us day one, but that is something that they are working to hopefully get implemented, that anyone that goes in through the federal marketplace, their eligibility will be deemed through the marketplace. Let's see. I will also mention that they have alleviated some of the COVID, or although some of the COVID waivers have went away, they still have a few that have been kept in place to assist counties, and that's the voice signatures that we can take applications over the phone and not require a wet signature, and also the reduction of residency documentation. Some of the stuff that we had to request, it's very difficult and can sometimes discourage someone for applying. I don't have all of these things. When you need 2 forms of residency, sometimes that's hard to get, and so they have reduced it to 1, which greatly helps us out as well.
Does that open the door for fraud?
So honestly, no. I mean, any individual can apply. As long as they're a resident of North Carolina, they can apply for benefits here. So we may have someone that's recently moving here to North Carolina. They just have to prove that they are a North Carolina resident to receive the benefits.
So can that be something like a utility bill?
Yes, utility bill. And if there is nothing that they have, we can get them to attest to their residency through a signed declaration. So I'll talk a little bit about the funding in House Bill 76 and 1.6B. There was indication that for fiscal year 23 and 24, there was a little over 1.6 million that was allocated per month, every month that Medicaid expansion was implemented. And then as we move into fiscal year 25 and 26, you'll see that per quarter there is an estimated or an amount that is issued to counties in the amount of 7.4 million and then 7.8 million. And every year after that, it is based on the Consumer Price Index. So we should expect to see that number increase every year.
Now, that's a total for the state.
Total for the state, yes. So I will tell you that DHHS has provided county financial support. We went to them and said, hey, we need some money to be able to start this process. And they were willing to upfront some monies to the local counties to be able to start infrastructure for technology, to start building some new staff, to do whatever we needed to do as a county to prepare. For Alamance, we took $130,378 that come to us. If you remember, that was at the end of last fiscal year, and there was a budget amendment that and it required us to carry it forward. And so we have been able to use some of those funds to build some of that infrastructure, with looking at kiosk up front that helps bring people in and move them through the process a little bit quicker, to look at what laptops would be needed for new staff. So we have been able to use that to the benefit of getting prepared. So with those 7.4, 7.8, all of those allocations for the state, the DHHS worked to equitably send that to the different counties, and they come up with a formula that they would use. And the formula is up on the screen. So there's a base of $5,000 for every county, and then it's based on caseload allocation. So for Alamance, we are expected to receive $26,075.54 per month for Medicaid expansion. And then I have put, beginning in December, the 7-month totals of $182,000, and then the annual amount as we move into the next fiscal year. Now, as those allocations do increase over the next fiscal years, it is anticipated that this formula may change because our Medicaid caseload will be increasing with the onset of Medicaid expansion. So that is just a projected amount based on the formula that we know now, but it could be increasing as we move forward.
What happens if that number is bigger than what we are thinking to allot all these funds for when it comes to Medicaid?
As
'Cause
far
you
as the
never-
expenses,
yeah, you never know what's going to come through your door till you finally open it. Because this has been hyped up for so long. There
Right.
was big controversy, Hatfields and McCoys in General Assembly, and I'm just curious as to what's going to happen when they're all lined up and the last two, sorry, you can't get it. I mean, what do we do?
yeah, and I don't know the answer to that, but as far as us, we're going to serve every individual that comes in through our doors, and we're going to determine eligibility for them based on the policies that we've been provided.
Okay.
So this is the request to come before the board today to ask for some additional positions that will help us with the implementation, and that will help us as we move forward into this increased caseload that we are anticipating. We are asking for 8 permanent full-time staff. Really, that's a hybrid model, so 4 permanent right now and then 4 as a time limited. And this just really gives us the opportunity to evaluate the caseload. Unfortunately, what we rely on right now is estimates. And what I would really like to see is some good quality data to know what the caseloads are going to look like as we move forward into Medicaid expansion. And then we're also asking for a IMC3, which is your trainer or lead worker position. Remember, I talked about the quality assurance aspect and the importance of making sure that our work is reviewed. And then as well as a supervisor to supervise the staff. Right now, all of our supervisors in economic services have about 8 staff members that they are currently working with. And that is really a big, big ask of them because the amount of work that those individuals are putting out. So this would be the ask for us. You can see I do have the cost of those staff members for a 7th month as well as an annual cost, and then the anticipated revenue that we would pull in. Our Medicaid staff members, determining eligibility is one of our highest reimbursed positions from the state. They come in at 75%, requiring a county match of 25%. But we can see that the additional funding that's provided through Medicaid expansion will offset that 25% for these positions.
I know in the past, when I was on your board, this was a hard area to fill. This is this is serious. They're all serious. But are you still short in that area, and where are these people coming from?
So I will tell you, we are competing with all 100 counties for income maintenance caseworkers, as we are with other positions within the agency. We have been very fortunate over the last little bit to work Attempt to Hire program that has given us the opportunity to bring individuals in on a 500-hour basis. And then ultimately, at the end of that 500 hours, be able to go through the interview process and offer them a position. So for some reason, the temp company was able to find individuals that we weren't, but we learned some lessons on interviewing through that, looking at applications, screening applications, those that we generally may not have looked at due to their job history. It taught us some valuable lessons in working with that. So right now there were 17 vacancies within that department, 4 of those in our food and nutrition and the remaining in Medicaid. But we have 8 individuals that are in the works, so that brings that number down significantly. And honestly, we haven't seen single-digit numbers in that area in years. So unfortunately, we are competing with other counties for that. If you look online, every county is hiring for Medicaid staff right now, as we are. But we continue to work in our community. We have we do ACC job fairs. We try to get out there because these really are entry-level positions into the agency. They don't require the college degree that some of our other positions do. So we really do work to try to get out in the community to share about our postings. And so lastly, I will just share that one of the things that we would like to ask is just some help from our community. And some of that is just to ask for individuals to apply via ePass. That will cut down on the traffic that's coming into our agency. But we also understand that there is a population that don't use the internet, and that's okay too. We will see them in the office. But we are trying to encourage the use of the ePass to cut down on the traffic that's coming in. We also ask for patience and understanding. We are learning this new policy. As I said, it was released to us about 2 weeks ago. We have a lot to learn as far as eligibility for Medicaid expansion. With the amount of applications that are coming in, it is likely that there could be delays. And unfortunately, that's the amount of application versus the amount of staff. I'm not sure that we're able to do, but we will do our very best. And I will tell you that our staff at the agency become very stressed over overdue applications. They understand the importance of every application that comes through. That application is not a number, it's a person, it's a family. They understand that, and they want to make sure that they're doing the best that they absolutely can. So that could result in you all receiving calls. Just know, anytime you want to come over, we're happy to show you the work that we're doing, share the numbers that we're seeing as they're coming through. Happy to just share anything about that, and know that we will be working as hard as we can. I will also throw in about NC Fast 2. It often has latency issues. We see downtimes. We see workarounds that are implemented that sometimes delay processing for us. So we also have to work through that as well.
I don't remember seeing in here the starting pay for each of these positions.
So the amounts that you see on the annual for the income maintenance caseworker 3 and the supervisor 2, that includes their fringe. But for our income maintenance 2 positions, it's around a little over 40,000. And then I believe the income maintenance caseworker 3 is about 42. And then the income maintenance supervisor would be a little bit more than that.
I just thought it would be a good idea for these folks to your left to have that information possibly and get that out there. It might
Sure.
help you find some people within the
Sure.
county that might be interested in something like that.
Sure. And so again, the request of the board is just to consider the positions that we're asking for that may assist us in the implementation of Medicaid expansion. And again, I'm happy for any questions that I might be able to
And you're
answer.
talking about really 10 positions.
It is 10 positions. Yes, sir.
I'm not clear exactly how where the revenues come from. So we've got the state reimbursement, 75, 25, 50, 50. What does that mean?
So Medicaid staff to determine eligibility, they pull down 75% reimbursement. So every month we are tasked to file the 1571, which is a state report that shows all of our staff, their pay. It also shows all of the expenses that DSS has. So we are allocated 75% based on salary, based on expenses for Medicaid as well. So that 75% pull down simply comes from the day sheet coding of those staff members. So as they're working, they're responsible for coding their time to Medicaid. And then it pulls down from the payroll that we upload into the 1571.
So you're saying that, I'm still not clear.
And I will do my best. So all of our positions are in some way, shape, or form reimbursed from the state. Based on
Their
the
salary or their work?
it is twofold. So you have day sheet coding, but you also have the salary that's being reported on the report. So every expense of DSS, including payroll and salary, or payroll and those expenses that we have out, goes to the state, and then they say, okay, based on this, we're going to give you this reimbursement back that comes in at the end of every month.
And that's from the state directly to DSS?
That's from the
to your-
state directly to
To your
DSS.
bottom line. And then what's the 50/50?
The 50/50 is those that are admin to Medicaid or provide supervision. So those supervisory position, they aren't directly determining eligibility, but what we see is there's a cost allocation process. Once those all is uploaded into that 1571, it spreads all of that 75% reimbursement across the board. So it's an estimate of 50% reimbursement for those administrative positions.
Is there some limit? I mean, if we hired 100 DSS workers, would the state pay 75% of 100?
So Medicaid funding it's uncapped. So Medicaid and Food and Nutrition Services, we code, they pay it back to the county.
Okay. And then what is the additional Medicaid expansion fund? That's just.
That's the funding that was allocated in House Bill 76.
Okay.
So that
that's
per
our
quarter,
portion of the
that
state's-
is our portion of the state's amount.
And was there a limit in how many years that's being paid?
So the only thing that's outlined in House Bill is every year after fiscal year 26 would then be determined by the Consumer Price Index, which to me indicates that it is available each year following fiscal year 26.
Okay. So there's more revenue. Bottom line, we're anticipating more revenue to come to DSS's bottom line than we will spend in salaries. For
That
the
is
district.
correct.
Okay.
That is correct.
Okay, now, that's where I'm having a little bit of a problem. You said it's 75-25. The county's
Yes.
responsible for 25%. Your chart here is saying, I'm just gonna go to the annual. $600,505.44
Yes.
in annual expenditure,
Yes.
but $731,688.56 in revenues.
Yes.
Is that including county funds? Where are we getting?
So no, that additional is coming in from that additional Medicaid expansion money that's being allocated through the House bill.
So in other words, we don't actually have a 25% match?
Correct. For these positions.
For
I
these
mean,
positions.
you already have a 25% match for our
Okay.
other Medicaid staff.
I got
This
you.
just is in addition to the pull down that these individuals will pull down
Right.
as they are working through their Medicaid
So for
caseload.
this piece, the state's basically funding the whole thing, of state or feds.
That is correct.
Then why don't we ask for more people? I mean, well, I mean, no, seriously, if we're gonna get revenues of, in addition to the expense, why would we not have more people to do the
So
work?
I do think we're trying to be not cautious, but to be mindful of the amount of people that we will need. So we currently have 41 staff member. Right now, their caseloads are a little bit higher than what we would like for them to be. But we know that with the additional caseload that will come in through Medicaid expansion, we anticipated the need of around 8 staff members.
So the excess revenue, can it be used to supplement our 25% match on the other side of the equation?
Yes.
All goes to DSS.
Yes,
Is that
I
a
mean,
Susan
this,
question, or is that a
this
you
all
question?
comes into our Medicaid revenue line that's allocated in our expenditures. So last year, our Medicaid staff pulled in around $2.4 million in revenue for their coding and their salary. So this all goes into our revenues that we report out to our board every month.
Okay.
That can be seen in our revenue lines as it comes in. We also have state reporting that's provided to us that shows the
Right.
amount the breakdown of that big lump sum that comes back over to DSS, which is then split into the many different revenue lines.
I want to tell you something about Medicaid. Several months ago, I was contacted about a lady living in her car. She's on Medicaid. She has a very serious illness. And the car wouldn't even start. I was just a hot mess. I mean, it was just pitiful. And she had 2 dogs. And like most people, that's her life. And Robbie Lennons and Leslie Jones were amazing. I cannot thank them enough. And then I had a 20-year-old to show up at my Celebrate Recovery one night, and Ethan Rayner was amazing. So I don't think a lot of people see the real work that DSS does. You just hear the numbers, you hear the staff, Medicaid, state, all that. You really do amazing work. And she's in the house now, let's mobile home, and she's doing well, but she's not well, but she's not in her car. There were so many people that pulled in to get that car fixed, tires. I met so many people in Burlington I never knew existed that were willing to step up.
Yeah.
And I can't brag enough on DSS for the work you do, that you never get told. And they'll probably kill me for mentioning their name, but I think they need to be saluted because they're real warriors out there on the street.
Yeah. Thank you for that.
Hey, Mr. Lashley.
The only question I was going through and thank you for your presentation. It was very, very informative. I didn't see anything in here. What's the income requirements that you say that it's you got in your presentation? You use household,
Yes.
and I was just
I wondered
wondering
about that
what
too, Bill.
what that number is.
So I will tell you, it really depends on the Medicaid program that you're applying for. But looking at the increase that we will see from full Medicaid benefits right now for an individual that may have a dependent child. So let's say you have a mom with 3 children. The income limit per month is $644. Very, very small.
Yeah.
The increase will significantly increase to over $2,000 for a household of 3. Still a very, very small. You think about how would someone be able to
Housing.
support a family with a paycheck of less than $2,500 a month. But those are the income limits that we're looking for expansion.
I was just curious because I didn't see it, and I
Yeah.
know that the government, when they have limitations on.
I thought about bringing and showing you the chart. The chart's a full page with about 8 lines of different Medicaid programs
Oh,
that you
wow.
have to screen through, some based on age. Just really depends. And that's just for family and children's. It's much different over in adult Medicaid. You know, those individuals, especially with long-term care, they're evaluating trust. They're looking at 5 years worth of bank statements. There's a lot of difficult work that goes into a Medicaid evaluation. Those individuals aren't trained attorneys to look at trust. You know, they have never worked in a bank, so to sort through documents like that, it's really something that takes time and experience to be able to do.
He'd have loved that chart. He's chart material.
Go crazy looking.
I
at
will
it.
tell you, one of our board members actually went through a training at the Social Services Institute and come back just simply amazed at the work that's put into a Medicaid determination. I think he said he would have quit a long time ago if he would have had to do that. But it is a very, very detailed process. Sometimes it's felt to be intrusive. You're asking a lot of questions about your household composition. Who do you claim on your taxes? That's a lot of questions that some individuals don't wish to provide. But unfortunately, that's the type of information that we do have to receive in order to make that evaluation for Medicaid.
So did you say in a household of, I presume 4, you're saying that $2,500 would be the maximum they could make in order to qualify?
Yes, somewhere around that.
Wow.
You're talking some teachers now.
Beg your pardon?
You may be talking some teachers now. It's amazing
And that,
what's-
now I will tell you, we look at gross. Many people feel like you can come in with your net amounts, but it's actually the gross. So all of those things that come out that bring you below the
Talking about
level,
an AGI number?
we're looking at the gross amount, your initial pay, not everything that was deducted out. So that's really unfortunate at times and a detriment to some families.
Not an AGI number.
It's not their
Okay.
take home, right?
Yeah.
Ms. York,
Yes, sir.
are you recommending that we have the 4 plus 4 plus supervisor plus trainer
Yes,
at
Candace
this
and I
point?
discussed
And
this.
effective on what date?
Well, we would like to have the positions approved today so that we can go through the process of then advertising and working with the state for the funding on these. So the hybrid approach, as Candace called it, would be to allow for time sensitive positions that we would reevaluate based on caseloads, just to give us a better sense of what this looks like, because it feels like a big estimate projected caseloads right now.
So we're really talking about 4 permanent, 4 limited, based upon what you
Plus
just stated,
2 additional
Plus 2.
permanent.
plus the supervisor
trainer.
and trainer.
Correct. That's
All right, I'll make the motion to approve that.
I'll second it. Or
Back
Pam?
off.
Ms. Thompson has
Give me
determined.
that one, thank you.
I'll give you that one,
Thank you, I
Pam.
appreciate it.
Okay. Any further discussion?
I have a quick question. Do you envision any scenarios where the reimbursement is not more than the cost for these additional staffers?
I don't think we've been given any reason to believe that that scenario will hold out for us. We do know that we're going through a compensation study, so we may be adjusting some of the pay, but there's still plenty of funding there to cover those salaries.
Does this require a budget amendment?
It will eventually, yes. Not today, though, because we don't have it in hand.
Okay.
All right, would you restate the motion, please?
I can do that. We are asking, oh, I'm sorry, I have that wrong. Let me get back to DSS. We're asking for, the board to approve 4 permanent income maintenance caseworkers, 2 time-limited income maintenance caseworker 2s, 1 permanent income maintenance caseworker 3, and 1 permanent income maintenance supervisor to support the implementation of Medicaid expansion.
All right, now I made the motion, Ms. Thompson made the second. Any further discussion? All in favor signify by saying aye.
Aye.
Any opposed? Unanimous. Thank you.
very much.
Thank you.
Thank you.
But you
Thank
didn't keep
you.
it within 2.5 minutes.
I'll do better
Okay.
next time.
Given the lunch situation, are you suggesting we take a break at this point?
I will
No, we
defer
still got-
to our
Still
clerk.
got another,
We have one more public item. I think we can probably get through that before we head into closed sessions. That might make it
And it's
a
Baker.
logical break.
Oh, it's Baker. Here we go.
That was my,
One more item.
and ladies, thank you.
Keep those crutches for at least a year, Candace. I'm telling you.
Oh. Poor thing.
I think I can take the 2.5-minute challenge. It's gonna be brief. This is an update on the HVAC and roof assessment process for county buildings and ABSS buildings. So what I'm asking today is to authorize the county manager to expend a total amount of $747,000, $829.84, for both those assessment processes, and it'd be a corresponding budget amendment to move that from general fund into county capital projects. So the 2 contracts we've worked out, one with SCI and one with REI. That's their initial people, engineers. They're going to do a complete assessment of all school system roofs and HVACs and all county roofs and HVACs. It's taken a little bit of time because I wanted to work through the timing with them. It's a long process to do all of this, and they were all proposing, 6 to 8 months. We've got a budget coming up, so that timeline was tough for us. So what we've done is ask the school system, and as a county, we've identified the top 20 projects that we feel like are the most likely to need remediation or to need some work. So we're evaluating those top 20 roofs and top 20 HVAC systems. We'll have that by the end of January so that can inform our budget process. There's 83 total buildings, so the remainder of those we'll have done by the end of June, but we'll have the 20 roofs and 20 HVACs available for our consideration around budget time, and that I'm presuming is more than we will be able to fund at that time anyway. So that'll get us the results we need and time to make some good decisions in our budget, and we'll have a complete assessment by the end of the fiscal year.
so this will give us a priority list, a timeline for when things need to be done, and estimated cost, which we all know is gonna be bogus because it keeps going up.
So the timeline for needs is, it'll give us a prioritization list and then a kind of a level of significance as far as how bad it is, how quickly we really need to get on these items. That's the most important part. The cost, it'll give us a rough estimate, obviously.
I had to say that just so Bill didn't have something to say
No,
about it.
yeah,
So-
who knows?
So if budgets work-
I appreciate that.
Tough to predict
Had to
cost, but-
usurp you someplace there, Bill.
I appreciate that.
Have we done any kind of mold assessment on our own buildings for the county?
We've done some air quality tests and have taken care of where there've been some issues at a couple of our buildings. But we are continuing to work through those and test the air.
So as frustrating as what we heard the school system talking about, you know, DPI, you got all this tape, so to speak, of time, you know, how many months. We're seeing the very same situation with months, right? It's just not do it just like that. It's a process. Enormously frustrating, because do we still have water pouring into some of the schools from the faulty roofs that they've got? And I've read about Eastern. That's basically kind of new, and they're having some stuff. Is that roofer been contacted about getting his little self back down there and fixing that?
So individual roof projects with the school system where if they have water coming in, we're not waiting to assess that to do anything
Gotcha.
about it. I mean, this is not a county project. Our school system is obviously in charge of those, but just working with Greg, I know.
But
that-
didn't we mention that we were looking at kind of assuming that role or being at least partners with them in a meeting?
So partnership is important. I think it's a bigger decision to suggest we're doing more than that, but
Okay.
Right, this is just an assessment study, right? This is giving you the data to feel confident on a plan for priority.
so
When-
as a part of this process, I've asked these contractors both just to meet with me on a weekly basis right now. So every
Okay.
week I'm on a Zoom with them, and I've asked Greg Hook from the school system to be a part of those. So we're meeting every week, just talking about getting this process in place, but also what immediate issues are we seeing? Do we need to do anything right now? So we're
Well, not that I need to be in your life more or you in my life more, but could you give us an update on that if it's weekly? Because this is probably one of the biggest things we've ever had to do, and we need to know so we can support that.
Sure, and I just want to be clear, I'm
Even if
not,
it's nothing,
yeah,
I got nothing, that's okay.
I think what we're not trying to do in this process is second guess or to supplant the school system's job of fixing their roofs, right? We're just
Yeah.
trying to do this assessment. So that's really what those meetings are centered around, but everybody's in a room, it gives them a chance to discuss if there's a problem.
Well, we are partners. We've got to be. We're all serving the families, no matter what.
Right.
And their schools have got to be airtight when it comes to stuff like this, because we can't demold once a year unless we all start playing the lottery. It's just impossible. And we have got to learn massive lessons from this situation and make this right. Because like Bill's talking about taxpayers, it's out of their checkbook. That's my checkbook, all of us is. So I just think it's that important that we all stay up on the same line as far as what's going on.
Right, and the deterioration of the roof or HVAC system doesn't stop during the study. So I
Yeah.
think you'll see at your next meeting, you'll hear from Mr. Hook with a request for some emergency need roofing
Okay.
concerns. And those will continue to come because we're not fixing the roofs right now, we're assessing those.
Well, that works against us with time. Time is of the essence and stuff like this. So, thank you.
Thank goodness for a drought, right?
Couple questions, Mr. Chairman, if I might.
Yes.
Briefly, Mr. Brecker, is it correct that, so it's an analysis of roofs and HVACs that is systematic and comprehensive,
Correct.
which is, I think, probably new. I mean, to be able to take a systematic approach to say, we need to know the status of everything, I think it's important that we do that and we do it as quickly as we can. And is there a deadline? You mentioned some priorities that they're looking at. Is there a deadline to report back to the county on what those priorities are?
So the priority sites, the top 20 sites,
Yeah.
we have already established what those are. So there's different lists for roofs, different lists for HVACs, and that's just where we're going to start the assessment. So once they get into the assessment, right, that's not a final, this is what's got to be fixed
Okay.
list. This is, we need to make some decisions around budget times.
Okay. So the report, when do we expect a report from these two individual companies on priorities?
So those top 20.
On what to do? Not what to assess, but what
End of
needs
January,
attention.
you will have a list of 20 roofs and 20 HVACs prioritized with estimates of cost and what to do.
Okay. Now, the list of 20, so really 40 projects.
Yeah, they may be the same site. Some of them are the same sites,
Right.
some of them are not, but yeah.
And is it 20 ABSS facilities, or are there county facilities mixed into the top 20? Are they separate lists or no?
So the whole assessment is going to be combined eventually. At this point, 19 of them are school systems. We have one
Imagine that.
county facility on that list
Okay.
for the first 20.
Okay, so we're full report out by the end of January, but we're gonna be receiving information on this analysis as we go.
Sure, I'll keep you up to date. I mean, from a prioritization standpoint, they sort of need to look at those all together. And so I wouldn't expect that before the end of January. But certainly can keep you abreast of what's been looked at, what some of the problems they're seeing are. We can keep you up to date with
And
that.
these two companies are working in tandem with ABSS staff in charge of facilities.
Absolutely.
Great, thank you.
Mr. Carter,
No question.
Mr. Lashley,
I just have one, and it's about the funding. You want to take the 747 out of the general fund. Is it possible that we could use our capital project fund? I mean, we have $10 million sitting there from this COVID stuff. Could we use that?
Good point.
The revenue replacement funds. You
Could we use it for this situation? I mean, I think it's
You could,
probably a perfect situation to use it for, just because of the
a one-time nature.
19 roofs. And just to let the county folks know that, and I said this to the commissioner board last time, when this was over 2 years ago, because Mr. Haygood was here, and we went on a tour. And I had the great afternoon to sit with the maintenance guy for Alamance County, and we talked about a lot of stuff, and this was one of them. He assured me, and he went out and did the assessment, got back to me in 8 days, and told me there was one place that needed to be updated in the next 5 years, and it's across the street. So it makes perfect sense that you come to us and there's only one of ours and 19 of theirs. We knew that. So that's a good thing. That's a good thing. But if we can do it out of the money that we set aside for the COVID, I think this would be, instead of having hit our general fund, because this isn't going to be the last time that you come to us asking about hitting the general fund. Promise you that.
Yep.
So if we could do that, that'd be great. This time, I don't know if we'll be able to do it next time.
Sure, I think it was just the idea that this is also for the schools, and so we were putting it out of fund balance, but if you prefer to do the revenue replacement for the COVID funding,
well-
that's okay too.
You're the professional here, so I'm just gonna let you direct me to what you believe. Because there's some things in that, in the general fund, that if we're doing 19 schools, 19 roofs for the schools,
Yep.
once again, we're gonna go back to the conversation we had earlier about when you make a mistake, you pay for it. And this is one of those things, because I am certain that the 19 roofs that ABSS is concerned about, I'm almost certain that 2 of them were already funded 2 years ago. I'm almost certain of it. I haven't looked at my notes, but I'm almost certain of it. So if you could maybe direct me to which account would give this board a little bit more of a leeway to ask for money or not. How do I say this?
I would say for the fees that we're looking at right now for the professional services, general fund would probably be your best option, because these would be contracted. We don't anticipate that we would see higher
One-time use.
fees for these. It would be a one-time use. With the ARP funds, we would have to spend those within a certain time frame, and I know that there's been quite a few different conversations on how to use that pot of money. So if we get into a prospect where we're looking at those funds to possibly help offset some of the roofing costs, then we haven't gone ahead and taken that 700,000 when we could use those funds in another area.
So you're saying that by taking it out of general fund, it gives us some more options?
It gives us some further options when we have true cost of what the replacement repair costs are gonna be. Yes, sir.
Well, thank you. I do appreciate that,
Ms.
because it does
Thompson.
make sense.
I'm good.
you need a vote on this, at this point, to authorize the $747,829.84. Is that correct?
As
Motion.
well as the authority to sign the contract, because that exceeds the authority I would have without a vote of the board.
I'll make a motion to approve that.
I'll second.
We have a motion and a second. That's out of the general fund.
From fund balance.
All in favor signify by saying aye.
Aye.
Any opposed? It's unanimous.
I do
Thank
have
you.
one question for you, Susan.
Yes.
After this goes through the fund balance, can you give us a total of what that fund balance is?
Absolutely.
Thank you.
And percentage, please.
Absolutely. Right, we should have our audit, we're finalizing our audit, this month.
Great.
So we should have those figures closer to the end of the month that we can then share. I will remind the board that fund balance does not become final until the end of this audited fiscal year, but I can let you know the impact.
Okay. And you say you'd be done by the end of November?
Yes, sir.
Okay, thank you.
Yes, sir.
All right, we're gonna take a break for lunch. It is 12:50 roughly. Are we returning roughly at 1:50?
That's fine.
Quick question, Mr. Chairman. Do we have lunch coming in?
Yes.
Could we do a closed session over lunch?
The complication's gonna be the number of people present, those that are authorized and those that are not, and we'll be shifting people in and out during
But my
lunch.
plate will still be at the table.
And you can eat it in front of all these people.
As long as,
like
I think Greg Turner's hungry, that's what I'm hearing. Priceless.
as long as we're all concerned about Mr. Turner only.
See,
Oh, that's
Okay.
great.
We're adjourned for 1 hour.
Oh, that's awesome.
that's
in their, we would see it requested in their 24-25 request.
Our conversation was about
Start printing those up.
Okay, we're back in session. County manager?
Yes, commissioners, attached in your packet, you'll find the first quarter financials. Last time we had the wrong version, so we are up to date for you now. There's a list of highlights there. It includes opioid funding, sales tax, property tax. Both revenue and expenditures are highlighted in that required report. If there are no questions, that's the only thing I had for manager's comments.
Are we starting to see any positive trends on that? It looked like it was trending up a little bit.
On the sales
She said,
tax, or
since there are no questions. Oh, I'm sorry.
are you talking about sales tax or or something, some other source? Are you talking about sales tax?
Right.
I mean, it's still very early. This is not a season where
One
we
quarter.
see a lot of growth in sales tax. Next quarter,
Back to school, I guess.
yeah, back to school. So it looks like we're about 8% of what we have projected to collect. An increase of 200,000 over last year at this time is what we're seeing.
But we're only looking at 2 months. Well,
Yeah,
1/6 of the
early.
way through.
Yep.
I guess really take a look at it after, like, when you get Christmas and you look at
That's
February
right.
numbers.
Right.
Yeah, and so probably if we do the board retreat again near the start of the calendar year, we'll have some.
Can we do it
stronger
in like
projections.
Hilton Head or someplace like
We,
that?
we take direction from the board.
Now, where are you
I'm being
having your
facetious.
chamber?
I'm being funny.
It's better to have it in state.
If we're gonna go to South Carolina, might as well just go to Hawaii, right?
That's right.
It's all another state.
Okay, we're through with county manager now.
Thank you, Heidi.
Yes, you are welcome.
Commissioner comments? Ma'am, I'll call on you first.
I've just got one that, and it's not to trigger anybody, but I know when Bill was talking about the diversion center and how the cost has gone up, I remember our steel for the high school was 2.5 million additional, you know, it's a shame you can't order everything that day to make sure you're finished and you get it at that price. But, we were talking about the cost and the taxpayer, and, I know the last meeting, I didn't support the ACC bond as far as the training center, not the training center, but just the cost of it. And I think a lot of errors were made when it comes to water pressure was silly, but just the timing and all that. And I'd asked Susan about, and Heidi, about some things, and like with the issued principal of $15,135,000, the county taxpayer's gonna pay 7.902,268.75 over 20 years. That's millions. So it just seems like we just keep taking hit after hit. We gotta have stuff, but at the same sense, you know, it's just one thing after another. I know that's government, but that's a lot of money for all of us. All of us are taxpayers to have to think about over 20 years, almost $8 million in just districts alone. That's the business of it. You guys y'all know this, but it's just kind of striking. Golly, that's a lot of money. Whew. So, but I just hope next projects, just do them as soundly and quickly as possible and jump on better interest rates if we can. That's it. That's just kind of I know we're all mindful of taxpayer.
Mr. Leslie?
I just have that one question, just about what percentage did the teacher raise come through? So I got that answer. I think I'm good. Thank you.
Mr. Turner?
Nothing for me, thank you.
Mr. Carter?
I'm good.
So am I. Okay. County Attorney?
Yes. Good afternoon, Board. I have several closed session motions for you to consider. The first is pursuant to North Carolina General Statute 143-31811A4. I would ask the Board move into closed session to discuss matters relating to the location or expansion of industries or other businesses in the area served by the public body, including agreement on a tentative list of economic development incentives that may be offered by the public body in negotiations. Further, I would ask the Board move into closed session under 143-31811A3 to consult with an attorney employed or retained by the public body in order to preserve the attorney-client privilege between the attorney and the public body. The attorney will advise the Board on ongoing legal matters, including NAACP et al. V. Alamance County et al. Finally, I would ask the Board consider moving into closed session to consider the qualifications, competence, performance, character, fitness, conditions of appointment, or conditions of initial employment for an individual public officer or employee or prospective public officer or employee under 143-318.11A6. I do not anticipate any action after the closed sessions.
Motion to approve.
Have a motion second, all in favor, signify by saying aye.
Aye.
It's unanimous. We are now in closed session. Return from the closed session before we go, and I'm smiling. I thought that was classic. And we can't talk about anything that was said in the closed session.
Nope.
So, okay. Do y'all have to do this? We're back in session. Do we have a motion to adjourn?
So moved.
But we need to announce that no action was taken.
Well, I think our county attorney indicated that would happen, and in
Right,
fact, that has happened.
Okay. then that's
Except that
good.
we did do a personnel review, and that was very positive.
Sure.
I'll add that.
That's fine. That's all you need to report back.
All right.
Thank you.
Motion to
Let me,
adjourn?
Wait
Second.
just 1 second. Approach, please.
Me?
You. We gave her a 3% pay increase. She would help. We have a motion to adjourn, a second. All in favor signify by saying aye. Aye. Thank you.